All this while, the World Health Organization had not been in favor of a global booster dose rollout. The reason being that there are countries yet to meet the vaccination target of 10% in the world and to ensure those countries get access to primary doses before a few countries go ahead with a third.
The worldwide supply is now at a point of about 1.5 billion doses per month. And our targets for 40% vaccination, full vaccination of all populations in every country by the end of this year, there's enough supply to do that. There was certainly enough supply to get to the 10% target by the end of September in every country. If the vaccines had been equitably deployed, we in fact would have gotten there many months ago.
In August, however, Israel became the first country to offer a booster dose to its population aged above 60 years. Following Israel, countries such as the United States and France commenced offering boosters, while several other countries, including the UK, Denmark and even Sri Lanka, have announced their plans to administering a booster. In such a backdrop, the WHO's Strategic Advisory Group of Experts on Immunization announced yesterday that moderately and severely immunocompromised persons should be offered an additional dose of all WHO-approved vaccines, since they are less likely to respond adequately to vaccination following a standard primary vaccine series and are at high risk of severe COVID-19 disease.
And when I mean all of them, I mean the mRNA ones, the adeno-based ones, and the inactivated ones. We feel, as will be published, that there are a number of people who have a compromise in their immune system, and therefore they need a third dose as an additional priming process so that they're fully protected.
The group also said people aged 60 and older who received the Sinovac and Sinopharm vaccines should get a third dose too.
They are the ones that have shown the biggest problem in response, and this has to be an extended primary series. The use of another vaccine, not the same Sinovac or Sinopharm, as an additional dose may also be considered if there is enough supply and access considerations.
They further added that countries should initially aim at maximizing two-dose coverage in that population and thereafter administer the third dose, starting from the oldest age groups when implementing this recommendation.
Giving those booster doses to individuals who already have had the benefit of a primary response is, as has been explained before, like putting two life jackets on somebody and leaving other people without any life jacket.
But for now, Sri Lanka is focused on vaccinating students, academic and non-academic staff aged between 20 to 29 years of age at universities. The message of the chairman of the University Grants Commission to the recipients eligible is to obtain the jab from their closest university. At a time in which the health guidelines published by the Director General of Health Services have granted permission for the reopening of schools and universities, this measure, along with the adherence to health and safety protocols, ensure that universities will be COVID-free zones following their commencement. Though that is the case, health officials are not impressed by the attitude of a section of university students towards the vaccine.
We feel that the same problem that we observed when we were giving the vaccinations between the 20 and 30 age group would have been applied or applicable to the current situation. However, we need to emphasize the fact that vaccination not only protect you but also protect the community by reducing the risk of transmission of the disease. So vaccine will not prevent the infection. A person from getting infected will not be 100% protected. However, if everyone gets immunized, even if they get infected, the viral load that they will be shedding outside will be reduced to a great extent, and therefore the likelihood of spreading the disease will be minimal. And therefore, we need to urge and emphasize that all university students, before starting the universities, they need to get their vaccination done so that they will be protected and their community, their friends and all other colleagues also will be protected, and their family members also will be protected. If the university starts with a significant proportion of students without vaccination, likelihood of spreading or getting a cluster within the university is very high. Thereby, the education most likely be disrupted, and your loved one at homes also will be at risk. Do not wait for a specific vaccine. If you need a specific vaccine, that can be handled separately.
As for the inoculation of children between 12 and 19 years of age with comorbidities, Sri Lanka seems to be doing well.
දරුවන්ට එන්නත් කරණය ශ්‍රී ලංකාව තුළ ඉතා විශිෂ්ටාකාරයෙන් සිදුවීම් පවතිනවා. අපි වෙනත් රටවල් සහ විශේෂයෙන්ම කලාපීය රටවල් වලට සාපේක්ෂව දැනට වයස 12 සහ 19 අතර නිදන්ගත රෝගාබාධ, සංජානීය රෝගාබාධ හෝ වෙනත් දීර්ඝකාලීන රෝගාබාධ සහිත දරුවන්ට එන්නත් කරණය ඉතා හොඳින් සාර්ථකව සිදු කිරීමෙන් පවතිනවා. ඉතා ඉක්මනින් මේ කාර්යය නිමා කර ගැනීම ඉතා වැදගත්. මොකද අවාසනාවන්ත ලෙස COVID-19 තත්ත්වය මේ දරුවෙකුට වැළඳුනොත් සංකූලතා ඇතිවීම සහ විශේෂයෙන්ම COVID නියුමෝනියා තත්ත්ව සහ ජීවිත හානි හැවීමේ හැකියාව ඉතා වැඩි. දැනටත් ශ්‍රී ලංකාවේ ළමයි අවුරුදු 18ට වඩා අඩු පිරිසෙන් 67 දෙනෙක් මියගිය බවට නිල වශයෙන් තොරතුරු ලැබී තිබෙනවා.
Further, Secretary to Sri Lanka College of Paediatricians, Dr. Channa De Silva, also commented on what's to come.
මේ ලබා ගන්නේ ඉතා විශාල පරිශ්‍රමයක් දරලා විවිධ රාජතාන්ත්‍රික කටයුතු හරහා තමයි ලැබෙන්නේ. විශාල වියදමක් දරලා. එම නිසා මේ දැනට ලංකාවට ලැබිලා තිබෙන, ගෙනල්ලා තිබෙන එන්නත් ලබා ගැනීම අපි සියලු දෙනාගේ වගකීම. මෙහිදී දරුවන්ට පාසල් වයසේ දරුවන්ට අවුරුදු 15 සහ 19 අතර වෙනත් රෝගාබාධ නොමැති සාමාන්‍ය දරුවන්ටත් ඉදිරියේදී ඒ ක්‍රියාවලිය ආරම්භ වීම සඳහා දැනට සියලු සැකසුම් සකස් වෙලා තිබෙනවා. විශේෂයෙන්ම අවුරුදු 18 සහ 19 අතර කාණ්ඩයෙන් මේ ආරම්භ වෙලා විශේෂයෙන් ඔවුන්ට පාසල් තුලදී හෝ ළඟම සෞඛ්‍ය වෛද්‍යයන් නිලධාරී කාර්යාල හෝ වෙනත් ගැටලු තිබෙන දරුවන්ට විශේෂයෙන්ම යම්කිසි ආසාත්මිකතා හෝ වෙනත් ගැටලු තිබෙන දරුවන්ට විශේෂ වෛද්‍ය අධීක්ෂණයක් යටතේ රෝහල් තුල ලබා දීමේ ක්‍රියාවලිය ඉදිරියේදී ආරම්භ වීමට නියමිතයි.
By last evening, 14,716,803 persons had obtained at least a single shot of a COVID-19 vaccine. Out of that number, 12,480,870 persons have received both primary doses.
Glow and handsome. AAT multivitamin සහ UV filters දෙගුණයකින් වැඩි දීප්තියක් ලබා දෙයි.
මූණ ගැන හිතන්න. හිරු කිරණින් ආරක්ෂා කරගන්න.